Okay, let's do one more question. This is kind of a complicated one. I just adopted a dog from a rescue organization. She's been urinating very frequently. She urinates when I take her outside, but she also dribbles constantly when she is inside. She drips when she's sleeping and also when she's up walking around and playing. She's wet on her rear from all the urine, and I'm starting to think maybe this was the reason she was at the rescue organization, because otherwise she's a really sweet dog, and she's a purebred golden retriever, so I'm not sure why else anybody would have given her up. I have an appointment with you this week, but I'm wondering what we might find. I actually know how this one turned out. But to answer the question, when I heard this, I was really worried about this dog because the most common birth defect that causes incontinence in young dogs is a condition called ectopic ureters. So in a normal urinary tract, urine is produced in the kidneys, and then it travels down these two small little tubes, one from each kidney, called the ureter, and it enters into the urinary bladder. And the bladder is like a storage tank where urine is held until the dog is ready to void. And then the urine exits through a big, almost like a pipeline called the urethra. And sometimes dogs, and it's more common in females, they're born with those ureters, so the little tubes that carry urine from the kidneys. Those ureters bypass the bladder and they connect to an abnormal location. Like they might bypass the bladder and attach to the urethra, the big exit chute, or they might go directly into the vagina. And since the urine bypasses the bladder, which is where urine is stored, the puppy can't store it and can't hold it, so they just continuously drip as the urine is produced. Now, if only one ureter is abnormal, then the dog might dribble urine constantly, but it also might urinate normally when it goes outside because it can store some of the urine in its bladder that's coming from the normal ureter, but then it also drips from the abnormally located ureter. And that's probably what's going on in this dog in this question. In fact, it was what was going on with this dog in this question. Now, some dogs will have both ureters affected, and the puppy will just dribble. It never passes normal urine, and that's because none of the urine is being held in the bladder or the storage tank. Now, most of these puppies that have ectopic ureters also have a lot of problems with bladder infections and kidney infections because the ureters aren't entering into a nice sterile environment like the bladder, and bacteria can crawl right up those ureters and straight to the kidneys. It doesn't have very far to go. So these dogs might respond a little bit when you give them antibiotics, but will never completely cure them with antibiotics. The way that we would diagnose ectopic ureters is with a dye study of the bladder, and the dog does have to be anesthetized for this. And you might be able to catch an ectopic ureter on an ultrasound if you're, the specialists in Annapolis who are good might be able to catch it that way. I guess the other way you could do it if you had the equipment is with what's called a cystoscopy, which is like an endoscope or a camera on the end of a tube, a tiny little camera on the end of a tiny little tube, and you could actually just look around the bladder and see where the ureters are emptying there. So the treatment for ectopic ureters is surgery. In some cases, the ureter can be surgically moved back to the right location, and in the best case scenario, the incontinence would then resolve. It doesn't always go that well. Sometimes there's been such a long-standing infection going on in the kidneys that there's kidney damage, and one of the kidneys will have to be removed. Sometimes the ureter can be corrected, but the pet remains incontinence, and that's because a lot of these dogs that have ectopic ureters also have other defects in their urinary tract. So it's a sad outcome for this little puppy, and the woman who brought it in is actually trying to get the rescue group that she adopted it from to get some money together to maybe have the ectopic ureter surgery done, but it's expensive. We called one of the specialists nearby, and it is probably $4,000 or $5,000 to get that condition corrected. So kind of a sad case. Now, if you have a dog that's doing this dripping, and I've freaked you out now, there are a couple other things that might cause these symptoms. There's a condition called vulvovaginal stenosis, and that's just a condition where the vagina at the level where the urethra ends is kind of narrowed. So when the pets urinate, some of the urine gets trapped in there, in that narrowed area, and then when they lay down, urine will kind of pour out of there. And that's much easier to diagnose. A lot of times we can diagnose it just with a gloved finger, and sometimes that stricture can be stretched out under anesthesia, and that'll help the incontinence resolve. That was not what the puppy in this question had, but hopefully that one will turn out okay.